Hello, everyone, and welcome to our webinar on how AI is shaping leadership in patient access operations. I'm Jessica Levco, the editor of Healthcare Contact Center Times and the moderator for today's webinar. Healthcare Contact Center Times publishes a monthly newsletter and hosts an annual conference in Atlanta geared for hospital contact center leaders. And today we are very excited to co-host this webinar with CCCD Health, whose team comes all the way from the Dominican Republic to attend our conference each year. Our conversation will be led by two CCD Health executives, COO Valerie Gruyan and AVP of Business Intelligence, Raphael Pelletier. We're also going to be joined by Kimber Molke from Memorial Hermann Hospital. And Kimber started her career as a nurse, but now is the go-to AI expert at the hospital. Since 2004, she's been in charge of the hospital's AI assistant for the Health Nurse Line program. And I've interviewed Kimber before for several stories for our publication. And I think what's really refreshing about Kimber's attitude is that you don't have to know everything about AI when you first introduce it to your contact center. You just have to be open-minded, curious, and partner with the right people. So now that we've gotten through the introductions, I want to tell you a little bit about what we are going to be talking about today. So first, Valerie and Raphael are going to talk about some of the challenges in patient access. Then Kimber's going to discuss the leadership mindset you need to adopt for AI. And then finally, we're going to wrap up by talking about future AI trends, and we'll also have plenty of time to answer questions you might have. So now I'm going to turn it over to Valerie and Raphael, and then they're going to share a quick summary of the current challenges in patient access right now.
All right. Thank you, Jessica. Thank you very much. Well, first of all, as Jessica mentioned, my name is Rafael Peña Pelletier. I'm an economist and data scientist, and I'm currently vice president of business intelligence, among other really interesting things here at CCD. But most importantly, my background spans industries like telecom, consumer goods, healthcare, and financial technologies. But as I always say, I firmly believe that healthcare is where data truly meets purpose, both data and innovation. So I'm really it's really an honor for me to share thoughts with you all. So let's talk a little bit about some of those patient access challenges that we have seen and that we identify in the market. And let's start by stating that, and we always like to say this, and patient access for us is where efficiency and patient trust basically intersect. So it's that like frontline moment where technology meets humanity, and as many of you know, sometimes both technology and humanity they don't always or not necessarily see eye to eye, right? Or at least not as we would like. So there are challenges when it comes to adoption and new technologies. And let's be honest, right? Healthcare has been running a marathon with a sprained ankle, basically, and demands keeps rising. Patients expect Amazon-like experiences, which is what we all expect nowadays. And in all honesty, our workforce is stretched thinner than ever. So some of the things we're seeing is that rising patient demand and customer expectations that I would say keep evolving faster than our systems can adapt. That's a reality. We're seeing staffing shortages, widespread burnout among healthcare staff. We're seeing financial pressures, and those financial pressures are forcing every department to do more with less, or at the minimum, do more with the same resources. And last but not least, we're seeing fragmented, we're seeing reactive systems that still rely on outdated processes to solve what we call modern challenges. Well, as one CIO once told me, he said our scheduling system is so old. I think it still asks for punch cards. Those of you who know about old computational, so punch cards were needed to make the computers work, and that's both funny and painful to me at the same time. As a technology leader, right? I would love to see that moment where more technology is adopted and our systems are modern and up to date, right? So AI has stepped in as this promising answer, um, and I I think it is moving fast. It is actually moving faster now than it used to be, or that it used to move in the past. But let's be real. Um, while it is true that AI adoption has jumped from 3% back in 2022 to even 27% now in 2025, I still see that scaling solutions, and especially solutions that generate that real world impact that we're looking for, I think it's still hard. And when we look specifically at patient access, the opportunity to improve is, I would say, massive. So as we move into 2025, we're seeing not just interest, but also impact, especially on or in how AI is transforming patient scheduling, triage, patient engagement, and of course, all of the revenue cycle management and financial clearance that you all know. And I think that's where leadership comes in, right? That's what we're all here to talk about. Leadership in AI, right? So that's where I believe leadership comes in, basically to ensure we're not implementing AI for AI's sake, because at the end of the day, AI in patient access, it's not about algorithms. It's about people ultimately, right? People getting the care they need when they need it without friction, or with with the less amount of friction possible. So in here, I'll pass it on to Valerie, and I would ask you, what are some of these areas where you have been seeing AI making real life impact, Val?
Course, and thank you, Rafa. Hi, everyone. Like Jessica said, I'm Valerie Guyan, COO here at CCD Health. And for me, the most interesting thing about this is that it's in those very specific challenges that you mentioned, Rafa. That's precisely where we see that AI is proving more value. For example, if we can go into our next slide, please. Um, Thank you. Here we have first predictive staffing, right? We can plan proactively here. We can prevent burnout from our teams. Second, we have nurse triage support. Here, nurses can actually be fully present for complex care. Third, we have smart scheduling and routing to cut delays, improve navigation. This is something that our patients notice pretty fast, and they're happy and excited about it. And finally, we have real-time insights. So leaders can actually manage with foresight and not just daily firefighting, because we know, and we've all fallen into that trap of just being on a day-to-day and just avoiding the strategic nature of our role, right? So these are improvements that patients feel. They feel it when they get faster answers, they get fewer handoffs, clearer guidance, and even shorter calls, which we know they love. So for our teams, what this looks like is, especially in a high-paced environment, because we know where usually we evolve ourselves in high-paced environment, it feels like breathing room for them. Work becomes more manageable, and I like to say even more meaningful. So I think it's about, like you mentioned, Rafa, not implementing AI for AI's sake. So it's about making real improvements to our day to day. So if we can move into our next slide, please. Here we have a question that I want us to reflect on. How can healthcare leaders prepare their organizations to be AI ready, not just AI enabled? And when we think about it, I think we can all agree that, opposed to popular belief, technology, although yes, it is complex, it isn't the hardest part. adoption is. So when you adopt AI, it will basically thrive or fail depending on leadership decisions. So that's why we're here today. Let's think about this for a second. How can we ensure that we're doing this right? So if we can go into our next slide, I want to show you something that's very important. We believe that as leaders, whenever we're implementing any AI framework or where we're going into an AI journey, we have three main jobs. First, we need to take care of governance. And this always has to be step one, because this will be the backbone for any AI implementation. We need to take care of proper documentation, of processes, of guidelines. Are we setting the proper guardrails on ethics and safety? Are we implementing the proper oversight so that that technology is actually doing what we intended to do? And if we want to take it even a step further, can we add there a plan on how we intend to scale it responsibly? Then we move into trust, which is highly important. And I can't wait to hear what Kimber has to say about this in her experience. When we have clear communication about what AI does and what AI doesn't, we start gaining the trust of our team members. Because from early on in the beginning, as soon as they start hearing conversations about AI, the first thing that will pop into their mind is that either their entire job or part of their job will be replaced, or they'll probably be hesitant that the solutions that we're selling them will not really take care of the problems that we're seeing. And I think that as leaders, that's where we have the responsibility to give them the proper visibility of the goal. We need to tell them and share with them what that end goal will look like. How do we see that patient access looking like in the next 3 to 5 years? Make them part of you can call it a collective purpose. So that way they won't feel like they're just part of a problem. They're actually being engaged as part of a solution. And as you begin this journey, it's important to also to keep in mind, start celebrating when it's working with them, to be that support, but also having the humbleness or the open mind to actually acknowledge and pivot when it's not working like it's supposed to. Finally, and one that I think it's truly important, is change management. Because we're dealing with people here, like I mentioned. Are we training our team members in the skills and the competencies that they will need for this next chapter? And it's like Rafa mentioned, there's this platform that looks like it's going to need card punches to work. It's like when we went from being primarily using hard copies in the office to soft copies to doing everything in computers. As a business and as a culture, we had to upskill everyone to get into this next workflow, this upcoming expectation. So when we develop them, when we get them up to speed on this, we ensure that we are creating a culture that will not only support but sustain the adoption. Because let's remember, we're working with humans. So AI leadership in reality is people leadership, but just a little bit in disguise there. So in summary, if we circle back to that initial question, right? How do we build organizations that are AI ready, not just AI enabled? It's about guiding the people through the why and the how so that the teams will feel supported and not just replaced. And speaking about leadership and practical leadership, actually, Kimber, like I mentioned, has lived this firsthand in the nurse line team. So I'm going to pass that on to Kimber so we can hear about it.
Thank you. I am going to talk about how the nurse line was able to meet some of the challenges that were mentioned by Raphael and Valerie. I wanted to start with giving a little background about the Memorial Hermann nurse or hospital system. The hospital's been around for almost 118 years. There's over 35,000 employees. We have over 14,000 licensed nurses, And we had 1.8 million patient encounters for the last fiscal year. Memorial Hermann is a not-for-profit hospital, and last year they gave almost $500 million in community contribution. So the Nurse Healthline telephone triage falls under the community contribution umbrella. In 2014, the Nurse Healthline was established, and it was there to improve access to healthcare and to improve the efficiency of the emergency rooms in Harris and surrounding counties. We know healthcare consumers are uncertain about where and when to go for treatment. The Nurse Healthline is a free service for patients to speak to a registered nurse for clinical questions and concerns. All residents in Texas can call. Doesn't matter if the caller has insurance, if they have a primary care physician or a hospital affiliation. We're open 24/7 and 365 days a year. Some of the frequent reasons that the Nurse Healthline receives calls from adults are questions such that as post-op symptoms questions, medication questions, chest pain, abdominal pain, and even panic attacks. And we have a lot of parents that are calling for their children. The most common concerns are cough, cold, fever, medication questions, and influenza. For these callers, they did not know where to go to seek help, and the Nurse Healthline was there to help them. I had pulled up our call volumes from FY 2018, and the Nurse Healthline was receiving about 90,000 calls a year. Fast forward to FY 2023, and we're receiving 164,000 calls a year. These callers are still expecting fast, easy, and personalized service. I knew these expectations could only be accomplished if we started using AI to streamline our workflows. I was lucky enough to be one of the first implementers of AI for Memorial Hermann, and in 2023, our AI bot, and her name is Grace, was implemented in the Nurse Healthline work stream, and she was there to place follow-up phone calls. My leadership mindset for implementing AI was to shift from managing change to creating readiness. And the way I did that was using staff feedback that I'd received over the years and using dedicated staff meeting time to review these issues. The top concerns my nurses had were receiving too many non-clinical calls. They were rushing calls because they would see that there were calls forming in the call queue, and they didn't want people waiting or hanging up. And this was definitely leading to a feeling of burning out. When I introduced Grace to my staff, I introduced Grace as a solution, and I also introduced her as a member of the team. I definitely stressed that AI Grace would enhance, not replace, the Nurse Healthline staff, and would allow for faster routing of calls and better access to healthcare for our Houstonians. I had to set goals right away for adding AI. One of the goals was to allow Grace to take on routine tasks and free up staff members for complex tasks. I involved the staff in the pilot testing of Grace, and I also used staff feedback once Grace was implemented to refine workflows, to coach Grace on Memorial Hermann technology, and enable Grace to adjust her level of empathy with callers and adjust her rate of speech. So what exactly does Grace do? She places follow-up phone calls for anyone who has called the Nurse Healthline. She gathers the same patient satisfaction information that my staff are getting, but we also have her program that if anyone needs additional clinical support, she will route a call to my nurses using a unique phone number so that my staff know the call is coming from Grace. Data is extremely important when you're implementing AI. And so I needed data to show that it reduced the time that the staff are making follow-up phone calls, therefore improving employee and caller satisfaction. In order to do that, I have a real-time dashboard that I have access to. So for example, total calls since Grace was implemented is almost at 118,000 calls. And out of the people that Grace has reached, she's finishing the surveys at about 25%. And that is a higher rate than my staff were completing the surveys. And that lets me know that people are fine with talking to AI. We also have callers that are calling back and asking to speak to Nurse Grace. So then that lets me know that her conversation skills are at where we want them to be. I also was able to calculate FTE hours saved by using Grace to do these follow-up phone calls. And it was almost at 2,000 hours. And that is equal to one full-time employee that would just be dedicated to follow-up phone calls. I can tell you my staff is thrilled not making these calls. They were making 200, 300, and then if someone called in sick, then they would be ones from the day before, and then it would cycle and they couldn't keep up. The only calls they're making now are non-English calls, as Grace can only speak in English, but now their calls are between 5 and 10 a day. And that means freeing them up to take calls that are currently coming in. So for next steps, I know my call volume is going to continue to increase, and I want to build on our success of Grace. And so what we're going to have her do is start answering the nurse helpline number. And the goal of this is for the nurses to continue to be available to work on complex tasks. Grace will answer the number, our phone number, and will say, "How can I help you?" And then route the call to the appropriate location. Right now, we're like probably everyone else where it says press 1 for something, press 2 for something. Calls that we're getting that are that we shouldn't be, that we want routed are, for example, medical records, imaging, looking for someone that's admitted, billing questions, scheduling questions. Grace will keep these calls from coming into the nurse call queue. Some of the reasons that we're seeing an increase in calls is Memorial Hermann changed to Epic a little over a year ago. And now our nurse helpline number is on all the Epic discharge paperwork. And so this year we gave our nurse helpline staff access to Epic, and they'll look at the after visit summary because there are so many people who are discharged and still have discharge questions. This is definitely making our calls longer than they were prior to going into the Epic system. Because of our success too, there's other AI projects that have started at Memorial Hermann. And like with any AI, you still need to have access to a clinical person in case there is a question that's brought up. And we're the unit that has nurses available 24/7. I'm definitely looking forward to this next step, that AI will help us deliver quality care in the Houston community. Thank you.
Thank you, Kimber. And what an interesting journey. One thing that you mentioned, and I'd like to hear a bit more. Can you tell me a bit, or tell us a bit, what were those early pilots like when you involved your team there?
So we turned Grace on for probably 3 days. And at that time, there was enough calls that my staff got the complaints that were coming back from the people. And a lot of the complaints were people would say, "I need to speak to a nurse." And I didn't give that statistic, but I think I did have it on my dashboard, like total calls that were transferred to the nurse since inception it's at 1,478. So as you can see, out of all those calls, at the beginning, everyone was wanting to speak to a nurse. And, it takes Grace a while to have the language such that it becomes a nice conversation with a person. And then she knows exactly what category, how to react with, what people are saying. So the nurses had a big feedback into that was all of the training, or they say learning, AI learning. They were a big part of that. And then once they felt that they had that accomplished, then we turned Grace back on.
Yeah, that's actually really interesting. And it's a very interesting case study overall with Grace and the way you guys were able to implement it. But from a data perspective, though, how did you handle governance and oversight for this implementation?
For the implementation part, meaning the building of Grace, that was pretty much just management, only because it was easier to not have as much input into making it. I should say it this way. We tried to make Grace say the least amount of words that she could say, because people do not want to be on the phone and they do not want to listen to anyone. And we're just happy they're picking up the phone and we can check and say, how are you doing? So that was our biggest push, is how can we get what we need, make the patient know that we care about them, and get Grace off the phone.
So going back into your team's dynamics, right? In those early days, because I know that this is something that a lot of people struggle with. How do you approach that early buy-in from your nurses and your staff?
Mhm. Absolutely, my nurses and my staff did not want this. They thought for sure that it would take over their jobs and that people would lose their jobs. And so that's why I kept on bringing up to them, look at the problems that you're having or the complaints and feedback I'm getting. You're not able to do your job well. And the used to be that, okay, if the volumes go up, you can get more staff members. Well, that's not the solution anymore. And plus, you don't need a nurse in order to do some of these things that the nurses were doing. So I'm like, you can work at the top of your license. And this is now you can take your time with calls. Look at our abandonment rates going down. The callers are happy. And you can take the time to because we send information to callers so that they can take care of themselves at home. And I think it honestly took them seeing that no one got fired over like the first 6 months, and then they start getting happier, and then then everyone starts going, yay, we're not making these calls, and look at now everyone's available to take a call. So it was all positives, and we did keep on bringing that up at staff meetings too, like that you have to absolutely say, look at the positive things that Grace has done. Now I can tell you they're all looking forward to her answering the call. They can't wait now because they know they're only going to get clinical calls if we do it right. We did not have any gotchas, so I lucked out that it was set up well so that, there wasn't some huge problem that popped up, and I think that helped as well.
Yeah, of course. And you mentioned very important, meaningful results from the staff side. What results did you see early on and on the patient experience side?
So we get, I think for patient experience, we get I think it's 4 categories that the patients are filling out when they're interacting with Grace. And our patient satisfaction scores, interesting enough, have gone up. And I'm not attributing that to AI, but I'm attributing that to my staff having more time to do a really good call.
Really interesting, actually. I would say that before we wrap, Kimber, what's one leadership lesson you would like to pass along to somebody out there trying to introduce AI into their teams?
Yeah, so I still think I'm really lucky that Memorial Hermann let me be the first person to do AI. I feel like kind of a beta tester. And just I think the details are so important on how you're setting it up and who are your team members. I mean, I had people from Memorial Hermann. Grace is run by a company, GridSpace. And then our software system we use, I had someone from that software system too. And then I had Memorial Hermann IT. We had such a good team to start it out with, and I think that's why we were successful. And I also started talking about Grace probably a year before it even, like, the build got started. So the nurses kept on hearing about it, and I kept on saying how amazing this is going to be. So I think talk it up to begin with, but the biggest success is having that really good, strong team to put that together. Mhm.
All right. Okay. And so I think we can move on to, there you go. Thank you, Dennis. So we're going to talk a little bit about our leadership framework here. And thank you very much, Kimber, for your insights and for sharing with us your journey through transformation and through implementation of Grace and the AI solution overall at Hermann. So we truly appreciate your words and your time. So I'm gonna talk a little bit about our experience as well in the actual AI market. And so at CCD, we've learned that AI transformation doesn't necessarily start with data, but it starts with leadership, and thus the overall theme, right, of this webinar, and more specifically with a mindset that balances innovation and business continuity. So when you lead people through change, you're not only teaching them a new tool or a new solution, you're basically inviting them to trust something they can't see yet. And that's why our leadership framework focuses on 4 key dimensions, and I'll explain in more detail in a little bit. But each dimension, each portion of this framework plays a critical role in how we have brought actual AI implementations to life, and not only for some of our clients, but also for some internal systems and applications that we've built, like the Copilot, like the Pax Fidelity, and the iCare One, which are there's information about these solutions available out there in the market. And I think first we have to, well, talk a little bit about the technological dimension, right? Which is basically about building trust in the machine itself. And here we start with data integrity and transparency. Every model we deploy, whether internal or external, goes through rigorous validation, goes through a comprehensive process to ensure accuracy and fairness. Always, always accuracy and fairness. And we basically don't treat AI as a black box per se, right? And we strongly advise you don't treat it as a black box either. So we try to make it explainable, auditable, and we firmly believe that in healthcare, trust is earned, not necessarily coded. Okay. Um, and then we have the operational dimension. Really, really important piece when we talk about change management, piggybacking of what Valerie was talking about a little earlier. We have to ensure training AI and incorporating AI into an everyday practice, because it only matters if it makes work easier. We have seen a lot of implementations where AI, it's actually harder to operate than the original solution itself, which it simply makes no sense. For example, um, through platforms like the iCare One, which I mentioned previously, we have been able to embed intelligence directly into daily workflows to automate the repetitive. And so we can have humans focus on what truly requires empathy, expertise, on what truly matters at the end of the day. So operational leadership is nothing more than making technology feel invisible and yet invaluable for our teams. And then moving on to the organizational dimension, which is basically creating a culture of confidence. And here, we think here's where leadership becomes human per se, right? We focus on education, we focus on inclusion and dialogue. Basically, we aim to help teams understand that AI does not replace people. It basically, or it is here or should be here to amplify people's potential. And when your workforce feels ownership over innovation, as Kimber was referring to, we have seen that adoption comes naturally. So you don't need to do a lot of legwork to actually get people to adopt these technologies. And last but not least, there's the strategic dimension. In here, it's mostly about aligning innovation with vision, because leadership means linking every AI, or every solution that we aim to implement to a measurable purpose. For example, here at CCD, our initiatives align with enterprise goals: better patient access, improved scheduling efficiency, stronger retention, you name it. For us, at the end of the day, AI, it's not a side project. Is part of our business DNA. So we, again, reiterating, at the end of the day, successful AI adoption, it's not a technical achievement. We have been saying this throughout the presentation. It's not a technical achievement. It's a leadership one. And I'll finish here by saying that technology solutions do not transform organizations, but people do. And at this point, Valerie will lead us through some of the questions we should all ask ourselves when it comes to successful AI implementations, based on what we have seen through our real world case studies.
Thanks, Rafa. So what happens if today you find yourself with an implementation need and you don't know where to start? I think we've covered a lot today, but we wanted to summarize. So here, like Rafa said, we want to share these key self-assessment questions that will guide you through that adoption process. So if you remember that I said earlier, governance was step one, think of this self-assessment as step zero. This is what you will do as your pre-work before everything else is done. So first, do we have a clear strategy for AI and patient access? Can our teams clearly and very simply articulate not only the why, but also the how? Can they say what we want our patient access to look like in 3 to 5 years? Second, how are we governing ethics and compliance? Like Rafa said, privacy and ethics, are we governing them with intention? Are we ensuring the continuity of this transformation by building the backbone that we need? Number three, and this is a favorite one of mine, are we investing in training and workforce readiness? How can you ensure the team that you have today, that you are upskilling them, that you are developing them to be the team that you will need tomorrow? And with this, building their confidence, building their commitment, not only with the project, but with you as a leader and with the entire organization. Fourth, what small pilots can we start now with clear measures of success? Like we said before, can we inject this small wins along the journey to help keep everybody engaged and to actually measure the value that we're creating? Finally, how will we monitor bias, fairness, and patient trust? Are we keeping fairness and equity central to this design process for our solution? So we truly believe that if leaders stay grounded in these 5 areas, AI doesn't necessarily is going to replace that human touch that we want to provide. It will actually strengthen it. So with that, we'd love to hear if anybody has a question right at this point, and of course, continue the conversation. So I'm going to pass it back to Jessica.
Okay, well, thanks. We've actually had a few questions come in. Actually, the first one is for Rafa, and you'd mentioned that AI adoption in health systems went from 3% in 2023 to 27% in 2025. But many organizations are still struggling with scaled implementation. So, how do you think a contact center can move beyond pilot programs to really fully scale AI deployment?
Um, yeah, so that's actually a very good question. So um, I would say that the jump from pilots to production is where most organizations stumble, and it almost always comes down to data infrastructure maturity. So in simple terms, to put it simply, their data is not ready to support scale or production environments. And I would say we could break it down into a couple of common gaps that we see as a common denominator. First, we have the fragmented data ecosystems, because as you all know, healthcare is siloed, or it is, well, actually very siloed. So EMRs, risk, scheduling, billing, call center systems, they all speak different languages. So that's the fragmented piece. Um, Poor data quality and data governance is also another factor that we've seen, because even when data exists, it's often incomplete, inconsistent, or sometimes it's unverified, which leads to a lot of errors when implementing these type of solutions. And I would say last, sorry, but not least, um, many pilots or these solutions are sometimes built on isolated data sets, or sometimes even manual extracts, and that that affects in the form of lack of scalable architecture, let's say, and important, like, and necessary feedback loops as well. So that might work for a proof of concept, but at scale, you need real-time pipelines, you need real data, you need secure APIs, and continuous learning loops, so that the AI is able to adapt as data evolves in time. And the truth is that most systems are not architected yet for that level of automation.
Thanks, Rafa. Valerie, we've got one for you. This person is a contact center leader, and they're thinking about doing AI, but their agents are really worried that AI is going to take over their roles. So, what leadership advice could you give someone in terms of helping, kind of alleviate that fear for their employees?
Thanks, Jessica. And the fear is valid. So ignoring it, it will only increase that sense of resistance. So tied to what we've talked about today, I think it's about, I'm going to reduce it to 3 items, right? Number one, transparency from day one. Let's provide open communication about what we're looking for, and that will include them in. Number two, let's involve them in the pilot period, just like Kimber mentioned that she did. Don't just give them a solution, make them part of the thought process of how to come up with that solution. And finally, I would say showing results, letting them see those results and letting them feel those results. Because I believe that when staff actually see that they have more time on their hands for meaningful work, that initial fear actually shifts into curiosity. And I believe that that's when adoption will actually stick.
Very good. And then, Kimber, you had mentioned that Grace saved your team more than 1,000 staff hours and really kind of improved morale. And I know you're planning on, scaling Grace to handle more complicated, more complex interactions, but how do you maintain that balance between efficiency and that personal touch that patients expect when they call your line?
So that is interesting. You're thinking, people think of AI as kind of sounding the robotic, and that's like the old AI. And what I did with my staff too is I had them call in because we had a test line that they could call and talk to Grace. She truly sounds like a person. It's incredible the leaps and bounds that AI has made. And so I think if I was calling and you could get me immediately to my solution and you sound like a person, absolutely, I think that's a personalized touch. But again, we've always built in, if they want to speak to a nurse, there is a way to get to a nurse instantly. It's a dedicated phone line, and my nurses get the call and it whispers follow-up phone call from Grace, and they can answer it. So we do keep that personal touch. But I do think people are wanting quick, efficient, and if Grace can answer their question by transferring to the correct place once rather than 4 places in the hospital, absolutely, callers will be thrilled.
Very good. Well, thank you so much for everyone coming to our webinar today. We really enjoyed having one. And I know we covered a lot today, but I think the thing that really stood out to me is that, AI adoption isn't just about technology. As you can see from Kimber, it's about leadership and culture and keeping your agents at the center of care. And, we know that many of you are at different stages in your AI journey. And, whether you're just starting to explore possibilities or you're ready to scale, CCD Health is here to help support you in any way. And if you'd like to continue this conversation or learn more about how CCD Health can help your organization implement AI-driven solutions and patient access, please reach out to the team. And don't forget to subscribe to Healthcare Contact Center Times for more insights like today's discussion. Like I said, we're completely geared for hospital contact center leaders, and we hope to see you at our conference in Atlanta, June 3rd through the 5th. So thanks again for being here, and I hope everyone has a nice rest of the day.